Hello and welcome back to the Digital Dose, a podcast from EBO where we explore the evolving world of conversational AI in healthcare with a special spotlight on the NHS. I'm your host, Trudy Kerr, and as always, I'm joined by Richard Samuel, EBO's Director of Healthcare Strategy. Today's episode is a special one. In recognition of Mental Health Awareness Month, we're turning our attention to how digital tools, especially patient portals, can better serve patients in mental health and community settings. Now, Richard, you've been behind the development of patient portals in the NHS from day one, having led the original rollouts of portals in the NHS acute setting. So before we dive into what should come next for these portals, let's take a step back. Can you remind us what was the intention for the portal back then?
Morning, Trudy. At the time, the goal was pretty straightforward, which was to support elective recovery and give patients greater control over their care via the NHS app. Kind of by enabling patient self-service, allowed patients to book appointments, to view their letters, to check their results, and to receive messages. And it was, in essence, quite a transactional bridge between patient and provider. And that's not me in any way diminishing the value of the work. It's been really important, but by definition, it was transactional in nature. And so whilst we've succeeded onboarding a great deal of people and delivering functionality to patients through the NHS app, as our ambition grows and the use cases expand, there is a kind of time to take stock of what we've achieved and what happens next.
Transactional nature, what does that exactly mean?
So the ability to click on change your appointment, the ability to click on view my letters. You're not asking for any sophisticated interaction. You're simply pursuing a series of limited but important transactional tasks.
So what do you exactly mean by taking stock?
Well, going back to that original hypothesis that we had some very clear goals that we wanted to empower patients for elective recovery. And when I say elective recovery, I mean, how do we reduce the time people spend waiting for elective care in hospital? So what we decided was that what we needed to do was to ensure that patients had the ability to book, amend and cancel their appointments, so reducing missed appointments. And we wanted to make sure that patients had the ability to receive messages, complete forms, and view clinic correspondence. And that, again, is a foundational capability and really important, but it's not the be all and end all. And the taking stock moment is saying, so what next, why next, and what do people genuinely want to do? And how does the NHS start to change its relationship with patients? Given that we are looking to shift from an analog to digital ambition in the NHS.
That brings us right up to date with what we're talking about today and the mental health and the community sector. So if the current generation of portals isn't working so well for these patients, if you're seeing some gaps in what patients need and the interaction between them, how do you rethink that?
It's a bit like, if I use the analogy of a banking app absolutely has to deliver core functionality. It has to be able to offer patients' ability to view their accounts and transfer money. But if you look now at your banking app, it's delivering a whole range of other capabilities and services that people want. And that's the same analogy in healthcare setting. So what I'm advocating is that we now need to reflect on how they could evolve to do better things. And importantly, I think we need to reflect on who's currently using these portals and how are they engaging with them. Because we know that certain patient cohorts, certain demographics are engaging with portals more than others.
Let's guide this conversation onto this idea of mental health and mental health conditions, because people are consistently asking to be treated with empathy and respect, particularly in the case of mental health issues. How is that then a consideration with how you're moving forward with this?
People with mental health conditions tend to use portals less. Do they trust engagement channels? And is the system design set up to fully meet their needs. And by that, I mean, are we designing things which incentivizes, motivates, gives people confidence to navigate digital systems? Every digital channel has to be design-led rather than transaction-led. It has to be designed around how people want to interact with them rather than what the function of the solution should look like. Because if we're function-led, we may create really great transactional solutions, but people won't use them. And therefore, we need to be really thoughtful about the needs and the wants of the mental health and community sector, and how do we align our capabilities to do that. And just as an aside, we started off in the acute sector with an evidence base about how patient portals could bring value into the acute physical health sector. We held off from scale deployment of patient portals into the mental health and community sector because we hadn't done enough research around what were the characteristics and capabilities that needed to be delivered around portals for that community, because it would be wrong to presume that they would simply want the same functionality and the same capabilities of people using digital channels in the acute physical health sector.
You've really got me thinking there, Richard. You said that physical ailment patients and mental health ailment patients have a different way of working with these systems. Can I ask for some practical application of that? How would somebody who's dealing with a mental health challenge need to be addressed differently?
So many people with physical health needs also have mental health needs, and vice versa. And there'll be individuals who have mental health needs who are hugely digital literate and hugely engaged and motivated to navigate digital systems. So I don't want to create a stereotypical position. But what we do know from our survey work and user-centered design is that people with mental health conditions tend to use digital channels such as portals less, and that's due to a combination of access issues in terms of their ability to access internet and to have digital devices, digital literacy, trust, and system design that doesn't fully meet their needs. And that includes the design that addresses their motivation to use digital channels, their concentration and confidence to navigate these digital channels. So we need to be really cognizant of this and be design led around our digital interactions with patients who tend to have, on balance, these particular needs. And I'll hone in on 2 or 3 areas just to kind of draw that to light. So the first is around empathy and respect. So about 68% of patients with mental health conditions feel as if they're being treated with respect and dignity, compared to about 83% with other such conditions. So it's so important for us to ensure that in digitizing interactions with mental health service users, we are designing in empathy and respect. Similarly, we know that confidence in healthcare services and professionals tends to be lower amongst mental health patients compared to patients using physical health services. And so building and sustaining trust is a key consideration in the capability of patient portals in mental health care. And we also know that people in mental health services tend to have distinct needs beyond the direct medical treatment, including support and access to care and holistic support to address various elements, aspects of their life, be it housing or income or broader support. And that's beyond the basic care transactional capabilities of current portals. So thinking about how we build empathy, improved access, continuity, holistic support, and clear communications into our digital interactions with mental health patients is not a nice to have, it's a must have.
Richard, I love what you've said just there. And you mentioned something that is important to a patient of a mental health condition, and that is empathy and trust. And I just want to ask you, how on earth do you build empathy into a digital experience, into a digital service?
Yeah, so this is where technology is really accelerating and advancing our capabilities in this space. So back in the day, a few years ago, would be unable to deliver anything other than, I think, a traditional chatbot which would be a series of pre-programmed responses to a series of limited prompts from a patient. Where we are now with the use of natural language processing and AI is sentiment analysis. So we can understand how individuals are presenting and feeling. If the AI is able to process it, they're feeling a degree of frustration, then it can track the emotion of an individual and respond in a way which diffuses any concerns, and demonstrates empathy for any exhibition of frustration, and indeed can identify moments where potentially a warm transfer, as we call it, to an individual on a call center, for example, might be more appropriate than simply staying in a digital interaction. So the ability now of technology to replicate human-like conversations is enormous and must now be a key part, particularly for patients with mental health needs, where trust and confidence and empathy and respect is as important, if not more important, than patients with physical health needs. That's in essence what I mean by respect and empathy within a digital channel. Is humans tend to be the best, but actually now the evolution of AI capability means that we can replicate personalized human-like interactions 24/7, and able to guide patients through their journey, anticipate their needs, empowers them to take ownership of their care.
Just groundbreaking. You mentioned trust, and that trust is really important to anybody. What is trust looking like within a system? What does that actually mean in practical terms?
So trust is driven by two facets. One is trust in the security and effectiveness of the system. So is my data going to be stored securely? Am I going to have confidence in this interaction? So in some respects, the digital channel and trust in digital channels has to be the same. Is it going to be accurate and effective information delivered securely and not able to be accessed by individuals who don't want it? So that's kind of the first level. Second level of trust is, do I trust and have confidence in the interactions? And in that respect, how we build trust is by taking a more sophisticated approach by using behavioral science. So how do we use language and use interactions and prompts to build trust and confidence of the individual? And the power of language is incredible. If you position a particular statement in one way, it can result in frustration and concern and anxiety. If you frame a proposition in another way, it can build trust and confidence and empowerment. We also now need to build in the concept of behavioral science nudge, the use of language in a way which builds trust in the service. And again, when I talk about transactional capability, most of the interactions that are driven through current patient portals are typically scripted by well-meaning individuals who haven't been steeped in behavioral science. Where the NHS needs to go is to understand the power of language and the value of framing interactions with citizens in a way which encourages them to take positive behavioral decisions, feels empowering, motivates them to take actions which are going to be in their best interests. And that is a means of building a broader sense of trust in the service and trust in the digital channel.
So, Richard, what does the next evolution of these tools look like? What's the Patient Portal 4.0?
So the Patient Portal 4.0 is EBO's vision of this new kind of digital experience, one that's proactive, intelligent, and deeply human in nature. So EBO, we've designed an intelligent patient portal specifically to support mental health and community trusts, where engagement needs to be empathetic, not just efficient. So using natural language processing, we've created something far beyond a traditional chatbot. It's a virtual assistant that speaks to patients via two-way natural dialogues, offering personalized human-like interactions, available 24/7. guides patients through their journey, anticipates their needs, and empowers them to take ownership of their care with accuracy and empathy. And as well as being a virtual agent that uses text base, EBO are now bringing in synthetic voice so that it again increases access and reduces the barriers for more disadvantaged communities.
That's amazing. You talked about the evolution, including this behavioural science. As this patient portal 4.0 moves forward, what other evolution is going to be included within this patient portal as we see it go forward?
So the other thing that builds trust is personalization. So we have confidence in our digital interactions where we know it's genuinely and truly personalized. The reason that many people go to Facebook or Instagram is that its algorithms are driving personalization. The whole focus of social media is to personalize to the extent that you are fed a consistent diet of interesting and engaging activity, which draws you to come back time after time after time. But personalization in and of itself is the biggest win here. How do we shift from being a series of depersonalized, standardized interactions to ones which understand your personal preferences and personal needs and delivers content to you in a way which meets your needs? When I talk about personalization, I genuinely mean the ability to use, if you like, a customer relationship management tool allied with conversational AI and behavioral science to genuinely personalize interactions with individuals, giving them content that will be value adding to them, using language that is accessible to them, enabling them to genuinely connect and engage with services. And that is what I mean by an evolution of digital interactions with patients.
That's incredibly important, isn't it? That there are services that go beyond the regular 9 to 5 hours and are available all the time.
Completely. We need to ensure that we're able to support, give advice, reassurance, or indeed crisis intervention 24/7. And that's what's so exciting about the application of conversational AI in this space is it's not a dumb conveyor of messages. It's an intelligent interpreter of language and the ability to route individuals based on their spoken word.
Well, you said about the NHS moving forward, and I'm really excited about this whole long-term thinking. Let's say an NHS 10-year plan. How does this fit into that?
We know that analog to digital and the digitization of interactions is a core part of the current NHS strategy, and we assume a core part of the 10-year plan. But there's this moment which I think we need to be really thoughtful about, which over the next 5 years, a third of all NHS interactions will be delivered digitally. So these new digital channels must offer a kind of exceptional user experience that's equitable, inclusive, and personalized. We need to kind of empower patients by providing the knowledge and skills and capabilities to allow them to make informed decisions, to practice self-care, building healthcare around seamlessly integrated into people's daily lives where they kind of work, rest, and play rather than the other way around. And therefore, we need to design our interactions about the needs of the individual rather than designing our digital interactions around the needs of the service.
That is remarkable what you had just said there, Richard, that a third of interactions with the NHS will be digital over this 10-year journey. And of course, we also know that the NHS is under incredible pressure. And that hasn't changed over the last decades, but it has increased. Is that where EBO's portal will prove its value?
Yeah, 100%. In our lives, we are seeing the exponential shift to digital channels and self-service, right? There's now not a facet of our lives where we are not seeing an increasing trend towards self-service using digital channels. And the NHS is probably a little bit behind the curve on that. But what we know from our own personal experience is that if the design of these solutions is great, then they delight the user and they bring value to our lives, right? They free us up individually to do more leisure time, more things we want to do. In the health sector, great, well-designed digital interactions have the potential to not only transform citizens' lives, patients' lives, giving them better outcomes and experience, but also to free up clinical and administrative time to focus in on areas where we can genuinely add even greater quality and value for the patient, but also to free up spend to cash releasing and non-cash releasing savings through reducing missed appointments, better treatment adherence, shifting from work that was typically done, which now can be done on a self-service basis. There is a fundamental error, return on investment around that work that when complemented by great outcomes and improved staff satisfaction, it is a perfect trilogy of value for the service. But it only happens where there is great user-led design, both the patient and from the staff concerned. And I think that's the kind of key message I would give is there are some great products on the market, but organizations who are looking to step into the space need to understand that the evolution of this capability is happening quite fast, and therefore they need to ensure that they're working with organizations that are bringing this capability to the table rather than selling and propagating older technology.
Richard, what a great way to wrap up. I always love talking to you, Richard, and it's a great way to understand exactly what is happening in the NHS. I want to say a huge thank you. That is it for this episode of the Digital Dose. If it sparked ideas or gave you a fresh perspective as it has for me, make sure you subscribe. We have got more meaningful conversations coming your way. Thank you for listening. Thank you, Richard.
My pleasure.
We'll see you next time.